Good evening. Thank you for having me tonight. My name's Dr. Jones, and I am a clinical psychologist here in town. I've had a private practice here for about 20 years, where I work with adolescents, adults, and I do some couples work. So I'm very pleased to be here tonight to talk about anxiety. And as always, when I give a presentation, I'm kind of anxious to give the presentation. And some of the symptoms I'll be talking about here in a few minutes, I am absolutely experiencing now. But I know that I will survive, and you will very likely survive too, if I just kind of push through it, and it'll get fun in just a few minutes here. So I'd like to thank Raya and the Rochester Hills Public Library for having me back, for bringing you guys together so we can talk about something that affects all of us. It's nice to see some familiar faces out there, although it makes me a little bit nervous to know some people here. The irony is not lost on me that I'm probably just as anxious as anybody. But if I were to ask one of you, and I'll pick somebody, during the presentation, to come up here and just give us a quick 2-minute discussion of the most embarrassing thing you've ever done, if you can imagine how you might feel, you'll have a sense for how anxious you might be. The fact that I get to push through my own anxiety tonight is something that I'm going to encourage you all to do. Anxiety, plenty in our lives. My quiet little practice in Rochester here is something I absolutely love doing. The patients with whom I've worked over the years have taught me more about anxiety than any of my instructors did or any of the books I ever read, because they're the ones that live it and give me the privilege of sharing their journey with them. Anxiety, more than most other clinical issues, that absolutely affects every one of us. And every one of my mentors and every smart person I've ever read has always said something like, we're more alike than we are different. And Freud thought that he would say that there's nothing in my patients that I don't see in me. So as I talk about anxiety tonight, you're going to absolutely be recognizing yourselves. Excuse me. So the talk tonight is aimed at parents of kids who might be anxious, and anybody else in the room who has a pulse. So raise your hands. Our kids have anxieties, we know that. We have anxieties about our own lives, and we also have anxieties about our kids' lives. It seems inescapable. There has been an increase in anxiety and in depression in the I generation, or the Z generation, which is kids born after 1995. We have seen an upsurge of anxiety and depressive disorders in those kids. And if we have time tonight, maybe we can talk a little bit about why that might be. But we know that our kids are struggling, and if our kids are struggling, we know that parents are struggling. You don't have to have kids to struggle with anxiety, but it certainly helps. Just to delineate a couple terms, when for our purposes, when I talk about anxiety, I want us to think about, that it's just simply a human feeling, but anxiety is a good thing from a certain vantage point. Anxiety is a signal to us that something might be wrong. And this is a part of us because of our evolutionary history, and it probably helped us survive sometime. But these days, our anxiety is no longer the same kind of good signal that it maybe used to be. In statistics, we talk about different kinds of errors in thinking, or errors in statistics. One is a type 1 error, the other is a type 2 error. A type 1 error is a false positive, believing that something is true when it happens to not be true. A type 2 error is a false negative, where you assume something is not true when in fact it is true. And the public intellectual and skeptic Michael Shermer talks about the fact that evolutionarily, back on the savannah, our forebears may have been walking through the brush and heard a rustle in the forest. If you assume if you assume that rustle was a tiger or whatever's on a savanna, a leopard, let's say, and you ran, you'd probably live to see another day. And that's true even if there wasn't a leopard there. That's a type 1 error. That's a false positive. If you think there's a leopard and you run, and then there's really no leopard, then you survive. But our forebears heard the rustle and assumed that's just the leaves. And it happened to be a leopard. They did. So slowly over time, we evolved to be type 1 error people, not type 2 error people, because the type 2 error folks were lunch. So that means that our anxiety system now is going to be filled with many more false positives, type 1 errors. And we'll talk about that tonight. Aside from the type 1 error, I want you to think about, because we're all fairly smart and fairly creative, and we are storytelling creatures, we will tell ourselves fascinating and terrifying stories about what's going on inside and why. And there's a bias in our thinking to emphasize the negative stuff and the scary stuff as more compelling than the positive stuff. Somebody that I know very well will focus tonight on the fact that there are 20 chairs that are not full tonight, when there are 100 chairs that are full, right? There's a bias toward thinking about the negative when there's so many people here. But somebody tonight is going to wonder about those empty chairs. 108. I'm going to talk about some physical symptoms of anxiety, but mostly to focus on the cognitive stuff. That's really where we scare ourselves with the stories. We only have a short time tonight, and hopefully I'll have a little time to answer your questions, because you'll probably have some. But I want you to take 4 key points away from my talk tonight. The first is that there is a vast difference and an essential difference between thoughts, feelings, and fantasies, the stuff that flies up into our minds, right, that we have no control over. None. It just flies up in our minds. I want you to know the difference between thoughts, feelings, and fantasies versus behaviors. We are not responsible for thoughts, feelings, and fantasies because we don't have any control over it, plus they're just ideas. We are, however, absolutely responsible for how we behave. Many people don't believe there's a big difference between those things, which means that their thoughts, feelings, and fantasies scare the daylights out of them, or they feel guilty for them. I'll sometimes joke with my patients about an ordinary angry reaction they might have to a deep frustration. And I'll sort of make sort of a playful joke about how furious they must be at somebody. And I have a tendency to sort of exaggerate it for clinical purposes. And like if you want to push somebody off a cliff, right? You can absolutely want to push somebody off a cliff. But you can't actually push somebody off a cliff. You can think about it, but you can't do it. You can, but it's immoral, right, and impolite. You just can't actually do it, but you can think about it. And if you think about pushing somebody off a cliff, it won't shorten their life 1 second. It's just a thought, right? Okay, so it's okay to think or feel anything. That's something I talk about with my patients all the time. The second thing I want you to think about is just because you fear something, and even if your body is on board for the experience, just because you fear something does not mean that you're correct. I'll talk about this cognitive distortion in a little bit, but oh boy, is that compelling to us when our whole body is telling us that there's something dangerous going on, or we're thinking about something dangerous. Therefore, we need to be afraid. It's not true. Occasionally, there's something to be actually afraid of, but more often than not, we're just scared or we're just anxious. So our anxiety will often lie to us and tell us there's something dangerous or scary, even though it's not remotely true that we're in any danger. So the third thing I want you to think about tonight is that anxiety is best thought of as an exaggerated fear, and that we're afraid of something that there is no objective reason to be afraid of. Feeling uncomfortable, which any one of us would feel if I ask you to come up and talk for just 2 minutes, you're going to feel uncomfortable. It might even feel terrifying to you, but there's nothing remotely dangerous about almost most of you, right? It's a pretty friendly room. You could come up and say something, and you would absolutely survive it, even though you'd have a dry mouth, you'd have some flop sweat, and you'd be really nervous when you sat back down. I'm not going to ask anybody up here. Anxiety can overwhelm us at times, of course, but it's good to keep in mind that no matter how lousy you feel, how scared you feel, it is going to pass on its own without doing anything. I'll talk about some things later tonight about what you can do to relax yourself, to breathe properly, and to do the things that can reduce the time you feel that bad, but it's going to go away anyway, no matter what, no matter how lousy you feel. Your anxiety is not going to tell you that. Your anxiety is going to say, this is going to last forever, and you're dead. But it's never true. Never, ever. So I want you to consider these quotes from Seneca and Epictetus, who are, they're two of a handful of very influential Stoic philosophers from the 3rd century BCE. This is what Seneca said, among many other things, that there are more things likely to frighten us than there are to crush us. We suffer more often in imagination than in reality. One of his contemporaries, Epictetus, said man is not worried by real problems so much as by his imagined anxieties about real problems. And a contemporary author that we should all be reading, Ryan Holiday, says there is no good or bad without us. There is only perception. There is the event itself and the story we tell ourselves about what it means. The Stoics emphasized the cardinal virtues of wisdom, justice, courage, and self-discipline. But a lot of their teachings are entirely consistent with our modern day approaches to psychotherapy that are kind of under the broad heading of cognitive behavioral therapy. They're entirely consistent with it. Each of the quotes emphasizes the internal origins of anxiety. And as a therapist, I love that the problem of anxiety is on the inside. It guarantees me work till I stroke out, so that's good. But when something is caused by us in our thinking and in our feelings, and if the problem is an internal one, that means we are also the solution. If there are problems in the world that are terrifying you, I can't do much with you to help that, so I'd much rather be on the internal stage. Here's the lousy news about the inside job part of it, though, is that the very lies and the scary stories are in there, and it's very difficult for us to not believe them because we're brought up to consider how we think and how we feel and to trust that. So some of the things I say tonight are probably going to be a little counterintuitive coming from a therapist, like don't trust your feelings. But I'm going to tell you to not trust your feelings so much tonight. So before I jump into the lies and the scary stories, let me first examine some of the physical symptoms of anxiety. And you will recognize them in yourselves. Here are the physical ones, most of them. Feeling nervousness, fears of falling apart, poor concentration, heart palpitations, shallow breathing, great amounts of worry, a sense of doom or foreboding, super cheery stuff, racing thoughts, tightness in the chest, sweating, flushing, urinary frequency, numbness, tingling, stomach GI issues, blurry vision and dizziness, sadness, blue mood, fatigue, headaches, muscle tension, and dry mouth. Notice how many of these are physical, right? And many of us have very expressive bodies, so that our bodies in their symptoms will be telling a very important story. My patients do this all the time, that if we pay attention to what's going on in their bodies, even though people aren't used to talking about such personal things, when we do, we can listen to what the body is telling them about what might be going on emotionally. Tonight, I'm going to de-emphasize the physical stuff and talk instead more about the cognitive stuff, because that's where the stories are. What I need to emphasize, though, in addition to that, is that when we have the physical symptoms, it, I guess, amplifies our certainty that there must be something wrong. Because if your heart is beating hard and you're sweating and all the things I just mentioned, the logic is there must be real danger, because look at how I'm feeling. But it happens to not be true. So without diminishing the impact of the physical manifestations of it, I'm going to emphasize the cognitive and thinking stuff. And this is where we find the lies and the scary stories. I have a couple bits of bad news as we dive in here. The first is that we are horrible psychics. Horrible. We are terrible at predicting the future, and we are equally terrible at reading other people's minds. Secondly, very sad news, there is no magic. Those of you who struggle a little bit with obsessive-compulsive features know something about magic. OCD-ish folks very frequently, if they have an unacceptable wish, an unacceptable thought, they need to do something about it to make it go away or to undo it. Do you remember in Shakespeare's Macbeth, that Lady Macbeth had arranged for a murder and then felt very guilty about it? And do you remember that scene where she was, I can't quite do it because I'm bionic. I can flip a car, but I can't touch my hands together. Lady Macbeth was washing her hands, remember? Out, damn spot. Because she, or Pontius Pilate in the story of Jesus at Golgotha, right? He too was literally washing his hands of something. Well, OCD folks do the same thing. The magic of washing your hands, checking a lock, making sure the refrigerator door is shut, tapping 5 times on something, not 4, not 6, but 5 times on something that protects somebody, pure magic. But if you're the person suffering from it, you need your magic, because without it, it can be terrifying. If you don't struggle with it, it's going to sound a little bit absurd. But for those people who struggle with it, it's deadly serious. There's also a different kind of magic that some of you parents might not like giving up, and that's the parental magic of my presence is the only thing that keeps my child safe. Right? So if I'm ever vigilant, always there, never turn my head, that's the only thing that keeps my kiddo safe. It's not true. The last, also false, is that worrying is the false belief that worrying is an active treatment, or that worrying will forestall bad events. Who's a worrier? Who in here would consider themselves worriers? Okay, so full hands, half hands, plenty of you. Imagine, there's 2 things about worry that I help people with. One of them is, well, it's not effective at all. You already know that part. But one is, people believe that worry equals love, right? Because we love our kids, which we mostly do, we want them to be okay, we want them to be safe, right, out in the world and at home. And if we worry about it, that's like loving them or like being vigilant. So to ask somebody, which I often do, to worry less, that's as absurd as dismissing the centurion at the gate. That is the only thing protecting the walled city. That's my worry. That's the thing that's protecting. And it's not true. And it never forestalls bad events. This is different than being reasonable about wear a life jacket when you're in the boat. That doesn't take worry, that just takes common sense, and that does indeed prevent trouble. But worrying about it has not prevented anybody from getting hurt ever. We know that anxiety states are generated by and are mediated by our brains. And there's some structures in the brains that are responsible for that, and that's what makes the physical stuff so compelling. That fight or flight system in our brain, when that is alerted, it sends off all these signals to our bodies and hormones, and our bodies react just like you'd imagine. But let's get to the scary stories, and let's get to the thinking problems that you want to think about tonight. We suffer from very common cognitive distortions that make our anxieties much more likely. The first is overgeneralization. And you'll recognize this in yourself. Overgeneralization is simply when something doesn't go quite right, or even if something goes badly, assuming and then in your mind that it's always going to be terrible. It's never going to get any better. Somebody gets a 78 on a term paper. That is a disaster because they only get A's, and now they've got a 78, and now they're not going to get into Harvard, and they're going to be a bum. Right? I mean, that's ridiculous the way I say it, but that is how anxiety works for people. They catastrophize and overgeneralize. Catastrophizing is what I just said, and personalization is assuming that other people's moods, behaviors, inconsistencies, or even rudeness have something to do with us, that we caused that. Think about that. Somebody's rude in a store. They cut you off with a shopping cart or in the road. It's very easy to assume that it's because of us. They don't like us, right? And despite we all know from our own experiences that other people are doing things all the time that have nothing to do with anybody. You know, people who are anxious are certain that all the other people in Target know how anxious they are, right? If you're on the verge of panic, you go to Target, people are certain that everybody can tell that they're anxious. And it's not true, right? That's just a scary story. People at Target are thinking about their own junk. And they're getting paper towel, and they're getting kitty litter, and they're just at Target. They don't care about us. But our anxiety tells us just the opposite. They care, they know, they're condemning me. None of it's true. Polarized or a dichotomous thinking is another one that gets people into trouble because it's almost like a form of perfectionism, that if it's not all something that's very good, it must be a disaster and therefore all bad. Or if I'm imperfect, which I am, that means I'm a disaster and a horrible, horrible, horrible person. That kind of dichotomous thinking leaves people suffering mightily because we are all absolutely imperfect. Even Salvador Dali, who was very weird, he said something like, don't be afraid of perfectionism because you'll never achieve it, which is entirely reasonable, even from Salvador Dali. Next is emotional reasoning, and that's sort of what I was alluding to earlier. Emotional reasoning is reverse engineering an explanation and a certainty about danger based on how you feel. If you feel afraid, there must be something dangerous around you, and it's not true. And the last is filtering. Filtering is basically we are collectors of negative experiences. If 7 people in your job review said, outstanding, 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 and one person said needs improvement, which one are you going to think about going home? Which one's going to keep you up that night, right? The 6 that said you did fine, or the one person who was having a bad day when they wrote your review? Filtering is how we collect the negative stuff. And it absolutely perpetuates our misery. Okay, let's talk about some lies that we commonly tell ourselves. One that we sort of talked about is the lie that our anxiety says that you are in danger and are powerless or you are weak. Very rarely true. Everyone knows and they are judging you. That's the target bit. I mean, I can worry about that tonight. Like my arm's not working and my voice sounds funny and I don't like how my pants fit right now. And so I can be worried about all of that, and certain you guys are judging me for that, and maybe a couple are, but probably you're not, and probably you're just trying to listen to this and read that. But the anxiety tells you otherwise. The anxiety tells you there's real danger and there's real judgment. Another fun one our anxiety tells us is that we are unlovable or that you deserve to suffer. I have a lot of people in my practice who are Catholics? Anyone? Fair amount. Okay. Catholics don't hold a corner on this, but Catholics are super good at feeling guilty about being horrible and miserable, right? Now, we all do this. Catholics are just a little bit more organized about how they feel about it. But we all do it. Because we all know the story. We all know we're imperfect, right? We're a little dumb sometimes, we're a little rude sometimes, we're a little greedy, we're a little perverse, we're a little selfish, blah, 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 blah. And all of those sins I just mentioned are all in our minds. Because in our actual everyday, we're probably not doing too much of that lousy stuff. But we are, in fact, thinking those things. And remember those thoughts and feelings and fantasies I talked about that just fly into our minds. People condemn themselves because of that stuff. I mean, if you doubt this about whether or not you have control over what comes into your mind, if you all just close your eyes for 3 seconds, just close your eyes. Now, don't picture a pink elephant. Don't think about a pink elephant. Don't picture it at all. Anything but a pink elephant. Okay, open your eyes. You all just thought of a pink elephant, even though I told you not to. That's how much control over you have of stuff that goes through your mind. Now imagine beating yourself up for something that you had no control over that went through your mind. When we're suffering greatly with anxiety, that's what we do. We beat ourselves up for this stuff that just flies in. And the stuff that flies in comes from all sorts of sources. I was trained kind of psychoanalytically and not a super great Freudian, but sort of in those traditions. And they talk a lot about the unconscious part of our mind. And the unconscious part is the repository of all of the dark, nasty, smelly, awful, embarrassing, shameful things that we might feel. That stuff bubbles up in our minds. We have no control over it. Fortunately, it is absolutely harmless. But our anxiety doesn't treat it as harmless. Our anxiety tells us that we're responsible for it and that we're terrible creatures because we thought about it. So now that you're unlovable, you can also tell yourself that if you worry, it will change things. Or, alternatively, you'll never feel any better. That's another lie we tell ourselves. You're always going to feel this way. I talked earlier about worry and its magic, or lack thereof. Still no magic. And that the emotional reasoning takes into consideration that the strength of your feelings means that the danger is real. Also not true. And lastly, that you will never get any better. Absolutely untrue. Even if you have a full-blown anxiety disorder, don't show me your hands. But if you have a full-blown anxiety disorder, you are going to feel better over time, even if you never do anything about it. You never talk to a shrink, you never read a book, you never practice your daily meditations, you're still going to feel better in time. I would rather you feel better sooner than later, because anxiety is pretty rotten to carry around. And psychotherapy or meditation or anything that helps you deal with it is going to foreshorten how long you're going to deal with it. So in my value system, suffering less is a good thing. How about some scary stories? Sure, I've got this. That there's danger around every corner. That there's definitely a monster in the closet. And when we're little, I don't know if any of you remember when you were little, or there's some of you a bit younger here, there were either monsters in the closet or monsters under the bed, correct? And the monsters in the closet or under the bed were always scarier than the monsters in the room, because your imagination fills the closet. Your imagination helps you animate whatever it is that's under your bed. And you remember how really scared you were when you were little. Genuinely terrified of the monster. And here you are, alive and well, no monster. And if you become parents, you'll be talking with your kids about the monsters that aren't there. Some parents just say, there's no such thing as monsters, period. Go back to bed, I'll stay in here with you till you fall asleep. There's no such thing as monsters. Then there's other types that think, okay, well, this is their imagination causing this, so let's harness the power of their imagination. We're going to make monster spray, and together we are going to battle these monsters with monster spray. I don't have an opinion about which one of those is most helpful. Whatever works is terrific. But there are no monsters. The monsters are really projections of what awful, awful things you've been feeling, who you're angry with, or how voracious you are, or all the things that come back in the terms of what we fear. Those of you, the younger people who are texty people, if my friend doesn't answer me within 3 minutes, that means they don't like me, right? And with smartphones, it's really weird how impatient we get with responses or the lack thereof. If somebody doesn't respond, we start making up stories about why they're not responding. Maybe I was rude to them yesterday, maybe, and I was just trying to get in touch to apologize, and now they don't ever want to talk to me, and they're probably telling other people about me. Or they're in the bathroom, and they just didn't take their phone, and that's why they're not calling you. But anxiety never tells you the benign story. So one of the anxieties that I hear a lot about, and because I have our oldest is in the getting into the college phase of things, that if our child does not get into an elite school, that it's going to be a disaster. Their life will be over. They're always going to live in our basement. That kind of thing. Or if we screw up once, that we're doomed and nothing will ever get any better. Total lies. We all do it, though, from time to time. People with more anxiety do it more and more. So let's talk a little bit about why it is our anxiety seems so prevalent these days. When in fact, and believe this or not, there's a really sweet book that Steven Pinker wrote a few years ago called The Better Angels of Our Nature. And he's a very data-driven, science-y type psychologist. And he shows with tons and tons and tons of data that we are living in our modern time today is a safer time to live than at any other time in the past. There's just no question about it. The data are there. But it doesn't feel that way. We're all dead, right? The coronavirus is, this is probably the last event I'll ever have. So I'd like to take up a collection, if we could. Just give a lot because it's all over soon. So it's true that we're safer now. There are some of you out there I know that don't believe what I'm saying. We're safer now than we ever have been in history. Now that is not true for any one person on earth right now. They might be living through something horrible. But as true as that is, in general, things are safer now. The expectable pressures that each of us has with jobs, lives, responsibilities, and bills, and the struggles of normal adolescence, right? All this cool stuff that happens for you with super great puberty and super great grades and super great sports and band and clubs and all the pressures to succeed, excel. Tons and tons of pressure in the system, which create unrealistic expectations and are ripe for your anxiety to just go hog wild with. Every once in a while, somebody can suffer from a more biological condition that can be the driver of anxiety states or even depressive mood states. It's not as common as some of the other regular reasons, But it does happen sometimes, and it's why I generally at intake suggest that somebody go and get a physical if they haven't had one recently. Go to your physician, get a workup, and make sure that you don't have anything weird going on with your biology. Like if your thyroid is messed up, if your thyroid is low, if it's low, you can be depressed, your energy can be drained, you can be anxious. It's very compelling when you feel that way. And it's completely caused by being hypothyroidish, which is not a word, but you know what I mean. There are other conditions that can cause anxiety states and fear states. There's certain types of remnants of old infection that can cause inflammation in the brain, that can cause symptoms that look very psychiatric, but in fact are just simply the result of inflammation that is treated by courses of targeted antibiotics. And once that course of antibiotics has some time, those symptoms clear up. One of the psychologists I was supervising told me a story of a girl who's 7, 10, somewhere in there, who all of a sudden had these profound behavioral symptoms, was lashing out, was just super angry, out of control. And this was not how she'd been before that. And they couldn't figure out what was going on. Nobody had hurt her or anything, like the kinds of things we wonder about. But she went and got tested, and the physician said, "Have you been anywhere out of the country on vacation?" And the parents were like, "Well, no, not for a while." "Oh, yes, we were. We went to a Caribbean vacation." And so she did another blood panel and found a parasite that the kiddo had picked up. And it was the parasite in her gut that was causing the problem. So with targeted medicine, which is fairly easy to do, parasite is taken care of. 2 weeks later, the kid is absolutely fine. That's the reason I like to rule out any biological reason, because the psychological reasons for anxiety and even depression, they're much trickier to treat and they take more time. So that's another reason that it can be there. You guys have heard a lot about this, but your kids, and even you, probably are feeling the effects and the pressures of social media, which can easily create anxiety and tension for people. To know that everything you do might show up on somebody's timeline, might be talked about in Snapchat or the other things I don't do and don't understand very well, but things can be very public in a way that when I was growing up, thankfully, they were not online, right? And any of you as old as I am or thereabouts, know that probably we did things back in the day that were not ideal. And you either got caught or you didn't. You've obviously survived it, and probably you stopped doing the dumb thing. But there was no record of it. Now there's a record of all of it. And it's just tougher, I think, to be an adolescent with that going on. And the idea that people are comparing each other and judging each other, and it's a very public event, I think creates more anxiety in our current culture. And kids are obviously very susceptible to that. There is a phenomenon I'm going to sort of almost end with that seems to affect our kids more than the generation before. And like I said, the I generation, or the Generation Z, are the kids born after 1995. So those are the kids that are getting older, starting off in college around 2010, 12, 14. There's a phenomenon where these are the ones that are showing these higher increases in anxiety and in depression. And one of the explanations for it, and there's this really interesting book, it's a bit controversial, but it's a very interesting book called The Coddling of the American Mind. I don't know if anybody here has read it. It's written by, let's see here, I think I have it for you. Yeah, Greg Lukianoff and Jonathan Haidt. Lukianoff's an attorney, like a free speech attorney, and Jonathan Haidt is a social psychologist. And they looked at trying to understand why kids were struggling more now than they were. And they found, and talk about in their book, that we have come to believe and teach three basic untruths And they're consistent with what I've said a little bit earlier. One is that adversity makes you weaker. That we believe that adversity makes you weaker. And we know that's actually not true, but we're raising our kids as if it were. We, more than generations before us, have cleared the way and the discomfort out of our kids' lives because we love them, of course. We do love them. But we have inadvertently not exposed them to adversity or not let them suffer an embarrassment or not let them not get a trophy or not get a ribbon if their team sucks, right? And because we haven't believed that there's anything about any way to grow from adversity. They call this, there was a author, philosopher, his last name's Taleb, who talks about anti-fragility, that kids are anti-fragile. And he uses the immune system as a way to use a metaphor for what our kids are. The immune system is set up in such a way that it is small bits of exposure to things that actually strengthen the immune system's response system. So over time, the kids that are outside in bare feet, getting a little gross, playing in the mud, doing gross stuff, are actually building a stronger and stronger immune system than are the kids that are in bubble wrap in the basement, right? They're not going to be the hardiest kids because their systems haven't been exposed to it. Kids are anti-fragile in the way that the immune system is anti-fragile. So out of love and concern, we have inadvertently protected probably a little too much. And I'm not advocating to be free-range parents, which usually just means you don't want to watch them and they can do anything and annoy anyone on any plane or any playground anywhere. But I think there's something about the balance of things that has swung a little too far in terms of our willingness to let our kids explore, skin a knee, right? Break a bone. We don't want those things to happen, but they do happen. If we always protect them, what do they call it? They call it like snowplow parents or lawnmower parents, as a distinction from helicopter parents. Helicopter parents are always hovering and watching, right? The snowplow parents or the lawnmower parents are actually making the way easier and removing obstacles from their lives. Turns out it's probably not a very good idea because overcoming obstacles makes you stronger, makes you more agile, makes you more determined, makes you more confident, even though it kind of sucks while you're going through it. Okay, the second untruth we believe that these two we're talking about is that to trust your feelings above all else, you and I already know that that's not a good idea. That's emotional reasoning, and that if all you're doing is basing what's going on for you on your feelings, you're going to be led astray. And the last is the belief that the world is divided into people that are all good or all bad. We talked about black and white thinking. It's never a good idea, which is my joke about all or nothing thinking. Like ever and always, nevers, they almost never apply. Like, I can't give an example where it's always. Can somebody give an example where something is always bad? Murder comes to my mind. Murder sounds bad. Murderers? Cowards. Just one. Well done. Probably murder is always bad, right? But killing somebody is probably not always bad, I think. Like if you're at war, you kill other people, and maybe that's justified. If somebody's breaking into our house and threatening my family, I hope I have it in me to make sure that that person can't move again. I don't know if I can, but I hope I can. So I'm sure there are absolutes, but most of our lives cannot be dealt with absolutes, all good or all bad. So that's all the bad news, right? All the scary stories, all the distortions, all the bad stuff that we do. What do we do about it? You are already doing what you were taught to do about it. You already relax as best you can. But I want to give you a couple ideas of things that you can add to what you already do to maybe live a little bit more comfortably or help your kids do a little bit better. And and then I'll give some recommendations for some readings I think you might like, and then I'll open it up for questions. Okay, what we can do ourselves, and I teach my patients these things. I prefer the things that we can do for ourselves, like different kinds of relaxation techniques. Go online, Google it, or YouTube it. There's tons of them, from progressive muscle relaxation, square breathing, all sorts of grounding exercises. Those are all different ways that you can practice to calm yourself when you're starting to get anxious. We know absolutely that if you're facing a scary, stressful event, like a difficult exam that's important for you to do well on, or some kind of band assessment at festival that's very important for you to do well on. If there's a stressful event coming, we know absolutely that if you listen to some calm and relaxing music before the event, you'll recover from your stress quicker after the event than if you'd done nothing at all. They've done these cool studies, both in medical settings and outside medical settings, and they measure stress hormones, cortisol, in your saliva. And the people that listen to the relaxing music before an event, their system resets quicker, and so they're soothed and calmed quicker if they've done that before. Super simple to do, right? You'll hear these days a lot about mindfulness or meditation. I know that sounds hippy-dippy, but it is absolutely helpful to people. There's lots of apps that teach you they're self-guided or guided meditation apps that if we just all practice that for 5, 10, or 15 minutes a day, we know we would reduce our anxieties. We know that would be quieter in our minds. We know that our immune system would do better. We're not all going to do that, but we should all do that. So you can go online and read about the different techniques for mindfulness or for meditation. It used to be that meditation had certain connotations because it was very connected to transcendental meditation, which I think is a fascinating approach to meditation, but it was sort of quasi-religious, and a lot of folks in the U.S. were not interested in quasi-religious, weird Eastern things. Well, the modern mindfulness and meditation stuff is not remotely religious, and so you can practice any religion if you have one and be a good meditator. There are anxiety workbooks and cognitive behavioral strategies that you can buy in books or certainly read about online. Those can help a ton. You can probably do yourselves favors by not looking at your screens or videos right before you go to sleep, because it's very stimulating and it's not going to let you nod off as easily as maybe listening to music. I like to listen to podcasts, a babbling brook, anything other than Seinfeld, which is fantastic, but you're going to pay more attention to that, and if it's visual too, that seems to be excitatory and not help you fall asleep. We know that if you're exercising or involved in physical sports, that's going to help decrease anxiety. If people who join and participate in religious activities or group activities, their anxiety levels are better. We know that reading books or print material is actually better for relaxation than just listening or watching a YouTube video. I would also strongly encourage you to actually have contact in 3 dimensions. Go with a friend, do a thing, have a coffee, meet up, versus just talking with each other on your phones. That's how phones look these days, like that. Rather than just online or while you're playing a video game. Those are okay, but I still think that we do better when we meet each other in the actual world. And lastly, good sleep, hygiene, and good nutrition. I'm not going to lecture on nutrition. I know the irony, but the better we eat, the better that we eat, the better our body functions. And the better we sleep, the more sound our sleep, the better we're going to function the next day. So all of those things we can do to reduce the amount of anxiety we carry. If that's not enough, there are professional services done by therapists in the area. There's tons of them. They're trained to help you with this stuff. There's medication out there. I'm not a huge fan of the medication because some of the anti-anxiety meds can be a bit tricky to be on. These days they're prescribing more antidepressants to treat anxiety, and those are not quite as tricky as the old like Xanax and Klonopin and Ativan and Valium. Those were super effective for anxiety, super addictive, and really easy to get in trouble with. The antidepressants, and again, I'm not a huge fan of them, but if you're suffering mightily and you can take them without side effects, it can round off the edges of things and help you stay plugged in while you're trying to heal yourself or get some help with what's going on. So that's all I have to talk with you about anxiety tonight. Do you have any questions as I'm talking up here? What occurred to you? No questions. Please. Sure. If you are hypothyroid, which means it's underperforming, that can lead to lower mood, lack of energy, what we call anhedonia, which is an inability to enjoy things you might ordinarily enjoy. Now, hyperthyroidism causes the opposite. You can be restless, it can spike anxiety, make you very uncomfortable, difficult sitting still, poor concentration. You want your thyroid to be functioning in kind of therapeutic range. And I don't know enough medically about what causes hypo or hyperthyroidism, but it's very easily picked up on general lab tests that your physician will do. The inflammation stuff I was mentioning is a little trickier because most physicians aren't doing the kinds of blood tests that some of the functional medicine physicians are doing these days. But it's out there. Please. I'm glad you said that. Did you hear the question about are there places in the area that focus on the gut-brain connection? And I should have put this in here because we're learning increasingly. I don't know any clinics that specialize in that, but I know that there are those of us out there that are starting to read more about this, and our physicians are starting to teach their patients more about the connection between gut health and emotional health. You know, here's a slightly gross example. It's not my grossness. We have a very complicated cat that you're allowed to pet, and then there will be a bite. That's how George lets you know that he's done. But last night, as we were falling asleep, my wife just moved him off a remote, and he bit her really hard, and she reacted like you'd imagine, and he left and then came back at her. Really weird. I didn't get up or do anything about it because she seemed to have it handled, but it was very weird even for our cat to do that. And then this morning, Deb realized, she said, oh my gosh, the kitty litter box, not only was it full, it's garbage day, but the door was closed. So he had no access to his potty. And right, exactly, very sympathetic. So Deb was certain that it was because he couldn't go to the bathroom that he was so crabby. And be honest, you would be too. So the gut health stuff is much more sophisticated than that. But the internal flora and all that's supposed to go on in our guts, if it's balanced and if it's functioning well, we have the best chance of be feeling and functioning well emotionally. When that is off, it can cause emotional disorder that doesn't have the usual origins of emotional disorder like I would deal with. Loss, abuse, inner conflict and all the good old-fashioned psychotherapy things. This one is absolutely caused by gut. As the physicians and as the therapists in the area are talking about this stuff more, probably you're going to see more people specialize in it and be teaching more about it. That would be a really interesting topic to have somebody come in and talk about, I think. There was another question. Please. About anxiety? Yeah. So much pressure. Probably there should be a more focused presentation on that. I'm giving a talk next week at Eisenhower. And what I thought originally was my sister-in-law's class. So I'm thinking, sure, like, 30 kids, 30 seniors. No, it's the senior class. I'm giving a talk to the senior class, second semester seniors. They're going to be thrilled to hear me, I'm sure. Right? I'll let you know how that goes. It should be okay, but I will be judged that time. My anxiety is probably right this time. I don't know of anybody who's specifically lecturing on that. I have two people that I've worked with who I think would be really great at it, who'd be able to talk with the kids about the pressures. And what I find is that a lot of the kids, the pressure, traditionally we've thought, well, if the kid's suffering under the weight of these pressures, it's because the parents are so demanding of them. And that does occasionally happen. But mostly what I see is it's the kids. Like, they are the ones who are putting massive pressure on themselves. Like, the parents are like, yeah, like, if you worked hard to get it and you get a B, you get a B. But the kids, like, nope. They're the ones putting very, very intense pressure on themselves. And the idea that if I don't get into X, Y, and Z college, then my life's going to be a disaster and I'm going to be a hobo, right? Absolutely untrue, but try convincing them of that. It's a problem because I really don't think these days that it's mostly parents causing it. There probably are parents out there who are really severe, and why wasn't that a 98% when you got a 96%? That's crazy. But there are parents like that, right? Don't raise your hands. We know who you are. But mostly it's like the parents are like, no, we're fine with that. If they get a B, we're fine with that. But it's the kids putting the pressure on. Maybe any other questions? Please. I am not very familiar with it, like NeuroCore, places like that, or neuro-linguistic programming. Mm-hmm. Yeah. Yeah, that kind of neuro-linguistic training is a little bit akin to what we used to think about as like biofeedback, where you can concentrate on images or representations of your body's patterns. And just by paying attention to those, you can, not intentionally, but you can start regulating them a little bit better. And I think that those programs are designed to capitalize on those same functions. So I would imagine that those can be helpful too. I don't know the data, but sounds good to me. I mean, I do talk therapy, and that can be very effective or kind of effective and sometimes not super useful, depending on the connection with the person. I mean, usually it's helpful, but it may not be as helpful as I want it to be. So the kind of talk therapy I do, that's not the only thing people can do. If there's something out there that offers this other way of dealing with it, that's fantastic. Doesn't hurt my feelings at all. Please. Mm-hmm. Okay. you are afraid of it, because you just said you were. I would say exactly what you said, except I wouldn't call it anxiety, because that sounds kind of clinical and a little labely. I would just say you're scared. No, you're scared about the test tomorrow. You're worried about the test tomorrow. Or you're worried that you're not going to do well on something. And if you just use regular layman's terms, then you probably avoid some of the clinically stuff that they might indeed. Our kids are going to outsmart us. So if they're determined to, they're going to outsmart you. And if you hand them a clinical diagnosis, they'll just say, I can't do that for this reason. We had friends of our family who their son was mildly autistic, more than Asperger's, but mild, pretty high functioning. And they took him to every expert when he was 3, 4, or 5. And many people said, this is all you're going to be able to expect. But they were determined to not accept that. And they kept pushing and expecting and getting him other kinds of help. And the kid's doing great, right? Doing great. College and the whole deal. And I remember the mother was telling me a story where she was angry with him for not having done something. And he said to her something like, Mom, with my poor autistic brain, I just wasn't able to. Total nonsense. And of course she was having none of it. So I don't think you're probably handing them anything to make excuses. But if they have legitimate struggles and the worries are getting in the way of adaptive functioning, doing the daily things, getting to school, brushing their teeth, sitting down to eat with you guys, or going to dance practice, then it deserves more of your attention. I'm sort of practical about these things. Like problems, it's a problem if it's a problem. If it's interfering with the everyday stuff, then it's a problem. No? Okay. Well, I appreciate your attention tonight. Glad you came out. I'll stick around here for a couple minutes if there's any other questions that you might have. But thanks for supporting the library, and consider the good work that Raya is doing in the community. They could always use good donations because it's really something what they do. So take care. Thanks.